Welcome back to Take 5, an inventory series where we look into a crystal ball to see the future of healthcare's supply chain, and when that doesn't work, read a bunch of news and scholarship and rely on our own decades of expertise. I'm Alex Diamond, and I finished up my conversation about hospital closures with healthcare CEO Carl Nattenstedt by focusing specifically on the problems faced by rural hospitals.
2019 was a high water mark for hospital closures in my 25 years of being in the healthcare industry. I think that the COVID-19 pandemic is going to only further hasten the closure rates of hospitals, and particularly hospitals in rural or community settings that were previously, again, operating on a very thin financial margin, oftentimes propped up by the local community, possibly by the county or local government. And those hospitals are going to be further challenged to stay open post-COVID-19, if not already closing during the crisis. We've already seen local communities, local counties, even activist groups in local regional communities band together to try to save their local hospitals. So that's been a common occurrence over the past 12 to 24 months. And I think particularly with a groundswell of kind of heroism from our frontline healthcare providers, I'll call it, that will only continue and possibly be amplified, where people will want to save that community hospital that's on the brink of closure. I know of one instance in particular in Pennsylvania where a health system was paid by the state a fairly significant sum in order to keep a hospital open in a community, specifically to serve COVID patients. Now, that being said, that's a very difficult proposition. First of all, it's not a one-time injection of capital. Typically, these hospitals that are closing are running at negative margins month after month after month, so the commitment is long if you want to try to keep it open in a small community or a rural area. Secondly, does it really make sense? That's a very difficult question to answer. Again, I think it will be answered community by community. I think we're going to see also just a big consolidation as we move forward past this pandemic, where many of those smaller independent IDNs or smaller hospitals that are independent in more rural areas will be joined at the hip and move into some of our larger groups like the Ascension, CHS, Tenet of the world, simply to leverage the strength of the larger organization, the financial strength, the purchasing power, the best practices, software, et cetera, that they can do to run their hospital more effectively.
So, getting hyper-specific to your experience in supply chain, Carl, when a rural hospital is forced to close, what options does it have for recovering some value from its on-hand inventory?
Unfortunately for the rural hospitals, like many things, their challenge is more significant, and reallocation is probably not a good option for them. There are some aggregations of rural hospitals or of smaller health systems, we'll say, that are attempting to do reallocation across legal entity boundaries. So, get 10 rural hospitals in Oklahoma, agree to swap products, so to speak, and everybody reallocates based on their needs and everybody benefits. And of course, you have the requisite transfer of funds and all of that. So there are definitely entities trying to do that. I think that's very difficult. That's more difficult than even a health system trying to do it, and it's hard enough for health systems to try to do it. So I think rural hospitals, smaller hospitals, single entity hospital entities, they do not have the reallocation option at their disposal. And certainly when and if they close, they definitely don't. So they probably have to go back to either an auction style liquidation or a liquidation through, a broker partner like a Z5 or some other reseller that could sell that product in the secondary market.
That's this week's 5 Minutes. Join us next time for an insight into suppliers and partners operating in hospitals during a pandemic. Take 5 is a production of Z5 Inventory. To see all of the sources and resources for this episode and more, visit z5inventory.com. That's the letter Z, the number 5, and the word inventory.com.